In 1949, more than 60 years ago, a young doctor traveled to Guatemala to help fight malnutrition in children. That doctor was Nevin Scrimshaw. Since then, Nevin Scrimshaw has made groundbreaking discoveries in nutrition that have been adopted worldwide. He has helped develop the capacity of researchers and institutions in the developing world focused on nutrition. To help do this, Dr. Scrimshaw created the International Nutrition Foundation in 1982.
Nevin has really been a visionary in the way he's thought about global nutritional problems and the underlying forces that create malnutrition. And it's not just nutritional deficiencies or poor diets.
If you go back and listen to him or look at literature in the 40s where nutrition didn't even exist within the public health realm, nobody wanted to talk about nutrition and infection. He has really laid down the foundation for what is nutrition today.
Scrimshaw, despite the fact that he appears as a simple person, he represents one of those very few people who have made history and are still around so that you can talk to him and still learn from his experience and even his vision of the future.
And he's so passionate. You can tell that nutrition isn't just his job or his research, but it's his life.
Dr. Scrimshaw's vision was to create a foundation that would generate support for training, research, communication, and policy related to food and nutrition in developing countries, working in collaboration with local institutions and scientists. Over the years, the Nevin Scrimshaw International Nutrition Foundation has worked toward this vision, awarding more than 550 fellowships to scientists in these countries towards advanced degrees, research, and training. INF has also disseminated nutrition research for over 3 decades through the Food and Nutrition Bulletin, a quarterly journal that publishes cutting-edge nutrition research and policy and is given to developing country scientists and institutions for free.
Another of his major contributions has been the training of literally hundreds, if not thousands, of people around the world that have followed this model of studying not for the sake of study itself, but for the application. And this has had implications in China, in India, in Latin America and Africa, and not only individuals, but shaping institutions.
I think the foundation has a very strong vision and philosophy in that it really believes in reaching out to people in developing countries and building the local capacity. I think it has always been Nevin's mantra, if you will, that capacity at the local level is going to be the way that a community and a society can develop and address its nutrition problems.
But this is the family. I'm proud of the various ways in which I've been able to foment the strengthening of institutions involved in public health nutrition in developing countries through a variety of means. We are already starting to train a second generation of people, staff for some of these institutions. The fact that we've been able to do so much with such limited resources indicates the potential for doing more if we can get more support.
As we talk, we have countries where mean life expectancy is 45 years versus others that is hitting close to 90. So with that level of inequality, it becomes very difficult to have peace, let alone health, let alone well-being of people worldwide. So in that sense, there is a moral imperative in addressing the pending issues, while at the same time, we have the problem of the cost of health, of maintaining health.
Some countries have been helped, and some have been helped more than others, but the vast number haven't been helped at all because they weren't ready for it. And now they're ready, and we should need the resources to respond to their need and their readiness.
There's no other institution I know of that can push that agenda as well as the Nevin Scrimshaw International Nutrition Foundation. It's got the vision, it's got the background, it's got the understanding, it's got the presence, and it needs to continue its work.